Hi there, it's Michelle from Baby Ladle. Today, the YouTube and podcast are just going to be me. Brent is not going to be participating. And it's just there's just some topics that I want to discuss that he can't really add anything to, so we just thought we would do it this way. So, October is Breast Cancer Awareness Month, and I'm sure, we all know someone, have it be a friend, a family, ourselves, mother, sister, aunts, daughters, who, have been diagnosed with breast cancer. I've been fortunate where, I haven't been diagnosed. I do have a couple of friends who, in the last couple of years who have been, and they've had to go through, radiation, multiple surgeries, chemo, and it's not fun. I lost my one grandma to breast cancer several years ago. I've lost an aunt back, when I was little, to breast cancer. And so I'm probably one of the luckier ones where there hasn't been a lot of, cancer in our family. So I'm not going to talk as if I'm an expert or, if I know, the ins and outs, because I don't. But what I did want to talk about is how breast cancer doesn't care. It doesn't discriminate. It doesn't care how old you are. I know, and it's quite funny because I know a few people that have had breast cancer in their late 20s, early 30s, early 40s. And yet, in order for us to, supposedly go for a mammogram or an ultrasound or the thermal imaging, they're saying that we should be, what is it, 50? I'm not 100% sure. So I find it just kind of, interesting that, the healthcare, professionals and the standards, industry standards or healthcare standards, however you want to call it, are saying that, you don't have to have mammograms until you're 50 years old, unless you have, a pre-existing condition. And yet I know three people who had no pre-existing condition whatsoever, and one was in her early 30s, and thank goodness that she's still around today. And then there's two of them that are, not too far away from my age, where, they had no history, and wham bam, holy crap. And yet, you know they've never had a mammogram, and they had no history, and it was just they happened to find it. And so you're probably thinking, well, how'd they find it? And so, like every year, because I have a little bit of history, and I have a doctor who, um, is maybe more on the cautious side, perhaps. I'm not sure. I've had mammograms since I was 35. I actually had my first ultrasound for a lump, that was found back when I was 27. It was scary. It turned out that it had something to do with, my duct system, because I was, breastfeeding and whatnot. But yeah, as soon as I turned 35, I had my first mammogram, I had my first ultrasound, and I've gone every year, I think, except for one. And so I'm actually going to be going here, within the next couple of months, and, having my mammogram and ultrasound and whatnot all done, again for the year. It's what I do. So I hear people say that it's very painful, it's uncomfortable. I'm a big breasted lady. I don't find it uncomfortable. I don't know, how I can't tell you how other people feel. I can't tell you that it's not going to hurt. I know for myself, it doesn't. I have a lot of fatty tissue in my breasts. And so, in the event that I do have a lump, the doctors and radiologists have told me that it should theoretically show up. It's not going to be one of those ones, cross our fingers, that it's going to hide. But who knows? And so, even though I go for those scans every year, and I need to do this, and I don't, and I really need to, I need to do the monthly checks. And I don't think of it. I'm not going to sit here and pretend that I do, because I don't. Yeah, sure, I shower and I wash and, whatever, but I don't lay down or stand in the shower and put my hand over my head and do the monthly check. And that's something that has been in the back of my brain, like, you really need to do this, considering people who have, that's how they've been diagnosed, because they've been 40 years old, and it's because they found a lump by doing a monthly check, or just because they just happened to touch themselves and they found a lump. And so I think, it's something that I really need to focus on. And I need to look. I don't know if there's a specific time of the month that is better. If I recall correctly, I think it's somewhere around, like, is it the week after you menstruate? Is it the week before? I don't know. So I need to, find out. And I know, like, I've had my doctor do the breast examination, with her fingers, and, she goes around and, whatever. So I have had it done. It's just not something that I have done. And so that was something that I really wanted to talk about for, October. I did actually ask a couple of people who have some breast cancer experience if they would like to come on. They didn't feel comfortable. I can totally understand that. I don't know. Knowing me, I'd probably talk about it because that's me, but that's not everybody. And so, that's a story for them to tell. It's not for me to tell. But just, I guess, why I was asking them to come on was I just wanted to know how did they find out? What were they doing that, that they found it? How, was it through a mammogram? Was it an ultrasound? Was it through, by chance? Was it through like a self breast examination? Like what kind of things do we need to look for? Or is there anything that we can look for? Is there anything we can do to prevent it? You hear that, some breast cancers are estrogen based. So in the back of my mind, and I'm like, well, do I need to limit the amount of estrogen that, I put in my body, through soy and I've often thought about, the HRT, the hormone replacement therapy, just different things like that, because there are different types of breast cancer, and they all have different rules and diagnoses and implications, and so it's hard. A few years ago, well, it's quite a few years ago now, I actually worked at the Cross Cancer Institute in Edmonton. And that was one of the things, it was my dream job. I always wanted to work there as a unit clerk, and I did. I did not last very long. I couldn't do it. I am too empathetic, and it was really hard to see people coming in and literally fighting for their life. And the biggest part for me was that there was people there that I knew, and I couldn't say anything due to privacy. We're not supposed to go up and be like, oh, hi, how are you? Because they may not want anybody to know that they're there. Some people go through this journey on their own. They don't tell their families or their spouses, and they want to keep it quiet. And the last, I guess, straw for me working there was that somebody I did know, they passed away, and I found out at work. And I couldn't tell anybody until it became public knowledge. And that didn't happen for like another 2 weeks. And so I was just like, I can't do this. Like, this is crazy. And who knew that, working in a hospital setting, where you were, I was so passionate and wanted to be there and whatever. And it was just something that I couldn't do. So I learned a little bit about, breast cancer and the different kinds of breast cancer and some of the treatments and whatnot there. But I can't even go by that information way back in 2010 because it's been 10 years and, treatments change and I haven't been through it. And, whatever. And so I guess all I'm asking for you to take away from this is to, if you've never gone for a mammogram, go have one. They do have the mobile ones that come to, the different communities. Talk to your doctor. Advocate for yourself, right? My biggest thing is to try to go to one of the locations that does have the upgraded mammogram machines that include the thermal imaging, because that picks up a lot. You can get private clinics. There's the Glenrose on like Stony Plain Road, where they actually have the thermal imaging that you can pay to go. I'm not sure of the cost, but I do know that is an option. However, I do know that Leduc and Devon both have the thermal imaging built into their mammogram machines now. They do have the newer machines. It's always good as well, if you can, is to get an ultrasound after, because then that really, gets into, the areas that a mammogram may not necessarily pick up. And the self-examination. And I think a lot of people, when they think breast cancer, they think women. And like I said earlier, breast cancer doesn't discriminate. And I went on to say how it didn't care about age, because I'm finding that more and more younger people are getting breast cancer. It's not our 60-year-old grandmas and aunts and moms. It's our age. It's crazy. And so again, is it environmental, genetics? I don't know. And so, but men can have breast cancer as well. And I don't think it's really talked about. Like, I know, we have Movembers coming up. A lot of men are starting to talk about that. They grow their mustaches and beards and whatnot for that, for cancers, below the waist. But they get breast cancer too. And so I'm asking, you ladies and moms and aunts and sisters and daughters to talk to, your husband or your spouse or your dad, your uncle, your grandma, your grandpa, the males in your family. Talk to them about breast cancer too, because again, I know of someone who was diagnosed with breast cancer within the last 5 years. And it's not, like I said, it's when you think of it, for me, it's primarily a female cancer, but it's not. So that's all I can ask for you this week, is to do a little bit of research if you're not sure about how to do a self breast examination, about when a good time to do it is, because I'm sure most ladies, because of our hormones and our cycle and whatnot, there's probably a better time to do it than not. To talk to your doctor about mammograms, ultrasounds, the thermal imaging, and just take care of yourself, and just keep this in the back of your mind as we're finishing up October, but that it's a monthly thing that we really need to do. So that's my my wish for everybody for this week, is to just be it's part of your self-care, and to just take that one extra little step and just take care of yourself. So this is Michelle, Baby Ladle. Let's get scooping.